Okay, teacher, good morning. My group is conformed by Oscar Iván Álvarez, Estefanía López Castro, Juan Pablo Jaramillo, and me, Natalia Gil. Okay, so to resume a little bit, what is the chlamydia? The chlamydia is an infection that affects all the people, including women and men. But the woman is the most affected for this infection because when the woman has the infection affects the apparent uh, system of the woman, so the woman can have pregnant a baby. The only treatment of chlamydia is antibiotics therapies because no, these infections no have cure, only treatment, and the people um, have to go to um, appointments every month or every 6 months to have segment.
Okay, now I'm going to talk about consequence of chlamydia because it's very important. It's very dangerous for people. Anyone who has sex can chlamydia infection through unprotected anal, vaginal, and oral sex, and different uh, forced sex, and how we're sexually active. Young people are the higher risk of contracting the infection. This is due to behavioral biological factors common among young people, gay, bisexual, other men, and who have sex with men are also at risk because chlamydia infection can be spread through oral and anal sex. Chlamydia infection is a common STD that can infect both men and women, and it can cause serious and permanent damage to woman's reproductive system and make it more difficult or impossible for the become pregnant in the future. Chlamydia infection can also cause on ectopic pregnancy, which can be fatal. In women entered chlamydia infection can spread to the uterus and fallopian tube, causing pelvic inflammatory desire. This condition can cause permanent damage to the reproductive system. This is can lead to chronic pelvic pain, infertility, and ectopic pregnancy. Women who have had chlamydia infection more than once are the higher risk for serious reproductive health complication. In general, our men in general do not have health more problems for chlamydia. Something is can infect the epidemics, the tooth that spread travels.
I'm going to talk about the impact on society. It's more common to find this disease in women than in men. Uh, it mainly affects women in society because their partner cheats on him and doesn't protect himself from contagion, and they don't remain with the infection. This is why it's important to be careful when having sexual intercourse. In Colombia, for the year 2009, only 1,538 people were diagnosed with chlamydia infection, and in the year 2010, 1,535, and in the year 2011, 1,313. Studies carried out in the country indicate that this is the most prevalent sexually transmitted infection in population groups between 15 and 49 years.
The government and its help. The government plan is based on action focused on public health and human rights. Although much progress has been made, major problems and challenges remain. And the correct use of latex condoms really reduce, but doesn't eliminate the risks of contracting and spreading chlamydia. And thank you.